So thank you for the kind words, David. It's really good to meet you as we spoke. I've heard a lot about you, but we've never actually met face to face, so thank you for the kind words. I'd also like to start by thanking Rabbi Grunfeld for the invitation to be with you today. It's an absolute pleasure and privilege to be here. And by way of further introduction, I speak too softly, so I'll try and... By way of further introduction, I work at the Royal Marsden Hospital, and I primarily look after patients with very rare cancers called sarcomas. And sarcomas are tumours of connective tissue, so the parts that join the body together. And very briefly today, I want to make 2 points regarding the excellent work that Mars does. The first is the importance of advocacy in rare cancers. So overall, rare cancers account for between 20 and 25% of all tumours. But unfortunately, the treatment and research of rare cancers has lagged behind treatment of more common tumours such as lung, breast, prostate and colon cancer, amongst others. And despite accounting for about 1/4 of all malignant tumours, there are many different types of rare cancers, and this means that each individual cancer is extremely rare. And consequently, the scientific evidence to support the use of particular treatments in each disease is limited. And basically, this underlies the importance of advocacy in these rare cancers. It's crucial to help inform patients and families regarding the best treatment for their particular type of cancer, but also to understand the rationale for using a particular treatment in that disease. And in this context, having worked in the United States and worked in the UK, I want to be crystal clear in saying that the advocacy work that Mars does is absolutely outstanding. Advocacy is particularly relevant to sarcomas. As I mentioned, they're extremely rare, probably account for about 1% of all adult cancers, but that 1% is made up of 100 or more different types of cancer, each with its own underlying biology and clinical behaviour. And the third factor that complicates sarcomas is that they can occur anywhere in the body because they are tumours of connective tissue. So there are 3 things: the rarity, the heterogeneity, there are so many different types, and the fact that they occur anywhere in the body. Those make these tumours extremely challenging to diagnose and treat. And because of this, when patients come and meet medical professionals, they're overwhelmed by these challenges. It's profound, it's bewildering, and it's very difficult for patients to get their head around this. And this leads to my second point, that Rabbi Grunfeld and the Mars team help patients navigate these challenges by not only asking the right questions, but also debating and questioning the rationale for a particular treatment or a particular management plan. And these are difficult conversations to be had, but I would argue that these are important conversations to be had for every patient, particularly with a rare cancer. I have to say that Rabbi Grunfeld approaches all of these conversations in a really polite and logical way. And I think and I've told him this face to face before, his clarity of thought, his intelligence and his knowledge is exceptional, and really allows patients to choose and also understand the rationale for a particular treatment. And on a personal note, I really enjoyed these discussions, these collaborative discussions with you, and I want to say that publicly. So I look forward to working with the organisation, and I really want to work more with Mars over the next few years. And I'd also like to say that the patient-centered approach that the Mars organisation employs is fantastic. So my two messages today are, first, that advocacy is essential in the management of rare cancers. And secondly, that the Mars organisation provides an outstanding world-class service to patients and families. And I'm delighted and honoured to support the organisation, and I'm pleased to see so many of you here today. And I urge you not only to support the Mars organisation in principle, but also financially. So with that, I think Rabbi Grunfeld knows me well enough now. I tend to be concise and to the point, and I'll tell David, I once gave a lecture. I prepared it, it was literally about 60 slides on alkylating agents, so a group of chemicals, and I stood up and I started to talk, and a woman in the front row just yawned. So from that day on, I've been very, very concise and to the point. So with that, I'd say thank you, and as I say, I urge you to support the Mars organisation. Thank you.